Another quick video here answering questions from our social media platforms. This gentleman sent a question. He says he's 32 years old, has been experiencing hair loss since age 27, and is asking if he's a good candidate for a hair transplant. Obviously, I'm not seeing him in person, so I'm going to go by what I see in the pictures that he sent here. So you can see a little bit of thinning, diffuse thinning throughout the top, but overall, early stages of hair loss. Typical male pattern hair loss, it looks like, because of the distribution. So there's some thinning along the front here. The middle is a little stronger, and then there's a little thinning in the crown. So if I saw him for consultation, at face value, you would say, wow, great candidate for transplants. 32 years old, I'm assuming healthy, looks to have very good donor zone here and not a lot of thinning. These patients can be deceiving at the same time. I agree, he's a good candidate for a transplant, but in my opinion, what I would do for this gentleman will be to put him on medication first to treat the hair loss so we can stabilize the progression, maybe make the areas a little bit thicker, and then proceed with the transplants once the hair loss is stable. A lot of patients come back to me from doctors that jumped the gun and did surgery without treatment, without stabilizing the hair loss. Then they come back a year later, they lost more hair, and they get into this never-ending process where they have to do more and more transplants because the hair loss was never treated. So it's important to address things with the right approach, doing things at the right time and the right way. So again, if I was seeing him for a consultation, I would recommend medications and therapy, and then transplants for sure. But yeah, to answer the question, I think he's a good candidate for transplants. He will be a lot better candidate if he's able to treat with the medications. Hope this helps. See you next time.